Hello and welcome to the JCN Clinic podcast show. I'm Jessica and today I'm joined by Christine Smith from JCN Clinic. Welcome, Christine.
Hello, thank you for having me.
So, Christine is new with us at the clinic. You might have seen her face on our socials, and you may even follow Christine because she has a lot of awesome content on Instagram. And really excited today to dive into talking about chronic fatigue with Christine. Like if you've listened to the episode with Eloise we did recently, I said at the start, Eloise and I hadn't had a major chat about that conversation. And I think likewise with you, Christine, we haven't chatted about your own experience with chronic fatigue or with fatigue in great detail. So I have just natural human curiosity and practitioner curiosity as we dive into this topic. So I think it'll be really exciting for people to hear what you've got to share in regard to chronic fatigue, but also, your own story that you bring to the table. So it's going to be a good one.
I'm excited.
Before we dive into the topic, do you want to just tell our listeners a little bit about you as far as how long you've been practicing as a nutritionist and a little bit about your passion areas as a nutritionist?
Yeah, so I've actually been in the nutrition industry or the nutrition world for probably close to 10 years now. But as a clinical nutritionist, I'm relatively new to practice. I've been in practice for just over 2 years now. And essentially, I started, it was probably over 10 years ago now, just started to do a lot of research into nutrition and just out of curiosity for my own health and those sorts of things. And I dabbled in like a few short courses and things like that because I wasn't sure whether or not it was really something that I actually wanted to dedicate more study to, or whether or not it was more just, like a hobby on the side. And I did a few short courses and then ended up doing like some health coaching and those sorts of things. And that sort of took me down the path of working with like young women and adolescents in high schools. So we go into high schools and do sort of nutrition coaching in that area. And then eventually I just felt like it wasn't as in depth as what I'd really like to know for myself, and then create a career out of it. So finally I bit the bullet and then ended up doing the bachelor's degree, which as a mature age student did take some time. But yes, eventually got through it all and now have been practicing. But in terms of what I like to work with in clinic, very much focused in the gut health side of things. So specifically with SIBO is probably one of the main areas that I really like to focus on. But just general digestive complaints that, a lot of us see, particularly at the JCN clinic. And then I've also got experience in weight management, with weight loss and also with weight gain as well, helping individuals that do want to gain weight. And then I guess my other area of focus that we will be touching on today is chronic fatigue syndrome. So having had experience that myself, which I'm sure we'll get into, it's an area that I really find really interesting, and sort of understanding it from each individual case because it can differ so significantly. And then, also working with it sort of as a line of treatment and helping clients to get some support in that area.
Yeah, that's interesting. Even with you saying being in practice for, use the word only, with 2 years, but I think what you just showed there is how much experience you brought to the table before even going into practice, which I think is really valuable. Because I think any practitioner that is listening knows when you come out the other end of your studies and you first start practicing, like it just feels very big, very overwhelming, and almost like, oh, I feel like I don't know anything. I'm right back at square one, just with the concept of going into clinic. But when you have such a strong background and interest in the nutrition industry and had dipped your toe in so much and been involved in so much, I know it would have just really accelerated those years for you going like straight into clinic. And I'm giving you a certain amount of confidence than the next person. I'm making that assumption, but I see that in you. I see that.
I think as well, like I said, you know, being more of a mature age student, you do have, you know, you've got that life experience, and you've got more experience in your own health challenges and how that affects your own quality of life. And so I think you go into practice and treating clients from a different space. It yes, of course, it is, you know, a clinical setting, and it is you know, a career path, but you've got so much more personal experience and personal empathy that you can share, which I think you may not necessarily have when you're straight out of high school, for example.
So true. So let's dive into this topic. So first and foremost, for people listening, we've mentioned chronic fatigue. That is something that we're very familiar with. But as Carissa and I always talk about, like sometimes you get so in your own world as a practitioner, you can forget just the absolute basics that not everyone listening knows what we're talking about. So could you start by explaining what we mean by chronic fatigue syndrome and what it is specifically?
Yeah, I find it's quite interesting because it is, I guess it's a little bit hard to define being a syndrome like other syndromes. It's basically a collection of symptoms. So you might have heard, say, for example, of polycystic ovarian syndrome. It's sort of in that same realm where it is recognized, but there's not so much a clear pathological disease pattern going on that, you know, you might be able to, I guess, diagnose, for lack of a better term. So I suppose when we're looking at the actual syndrome, it's more about what symptoms are presenting. I do know that they've come a little bit further in sort of the medical conventional world in terms of recognizing it. And you might have also heard of myalgic encephalitis. So that's basically another term that they use to refer to chronic fatigue syndrome. But essentially, yeah, it does come down to sort of a collection of symptoms. So obviously most prominently would be that fatigue. So, and that's, I find where it can get a little bit tricky, because a lot of the time when you hear the word fatigue, you automatically just think, oh, someone's a bit tired. But there's a huge difference between fatigue and being tired. And anyone that's experienced chronic fatigue syndrome they might not be able to articulate it very clearly, but there is such a distinct difference. And so it's almost, I suppose, when I'm trying to explain it to someone, it can be a lot like if you've ever had the flu, for example, and that's that whole body fatigue. So there's that sort of, tiredness or lethargy. And then it can be things like post-exertional malaise. So whether or not you've, and it really does vary from individual to individual, but, you might get up and try and do some work and then you're exhausted afterwards. Or for another person, it might be you want to go and do a workout and you're exhausted afterwards. So there's that fatigue, malaise element. And then it can be things like insomnia, you've got loss of appetite, so looking at sort of more those gastrointestinal side effects. You can also have a significant impact on mental health, so depression, anxiety can be present as well. And then also similar to like fibromyalgia, we can be looking at sort of like the muscle and joint pain. And then you've got issues such as like light sensitivity, brain fog, and really that, how do you articulate that sort of, you you can't articulate what you're wanting to say. It's confusion, memory issues, those sorts of side of things. So that's sort of what you're looking at in terms of how it presents. And then in terms of the medical world, if you will, the way that they typically recognize it is if those symptoms persist for longer than 6 months.
Mm-hmm. Yeah, as far as then moving on to how they would also look at diagnosis, like looking at that as a collection of symptoms, similar to, as you were saying about PCOS, or I think of good old IBS. It's like we have this collection of symptoms, all this criteria. Does this
Yeah,
person meet these? And also, what is the time frame that's associated? So would
exactly.
you say that about the diagnosis, that generally that's what is going to be looked at, is those symptoms and also the time frame, as far as how that's been going on for, or how long that's been going on for that particular person sitting in that clinic saying, what's wrong with me?
Yeah, and I find it's a little bit taboo, if you will, as well. Like
For
there's just
sure.
so much. Yeah, I find it really tricky. I know a lot of the clients that I see, they've been on such a long road, like with so many other conditions that we see in clinic. It's just taken such a long road to sort of get that. And I don't know, I hesitate to use the word diagnosis because a lot of the time they're not actually ever said, oh, look, you've probably got chronic fatigue syndrome.
Mm,
And so it's a really tricky one to pinpoint as to whether or not they are actually ever getting that proper confirmation.
mm,
And I think what does make it tricky is because it can differ so much depending on each individual as well. It's tricky to really get a handle on what is actually going on, particularly when we're looking at it from sort of a medical or conventional background.
absolutely. And even as you just outlined, like there's such a diverse array of potential symptoms that are going on with the chronic fatigue framework, I guess. Looking at everything from the fatigue level itself through to, you mentioned about muscle aches and pains, and then there's things like brain fog and memory issues through to digestive ailments. Like we're talking about a very wide span of symptoms. And I mean, we'll probably get into this, but just even thinking about how many of those may be going on, or whether it's just one or two for a person. And then we're looking at someone as a, inverted commas, diagnostic tool, wanting to put a time frame on that. It's also like, well, how long do you have to potentially suffer along with these symptoms before you're told, oh, well, it must be chronic fatigue syndrome? And then again, as we'll probably get into, what does that even mean? Like, as far as like with IBS, it's like, oh, you've got IBS, like here's our suggestions of how you go off and manage that. Goodbye. Like same with something like chronic fatigue. Oh, you've got chronic fatigue, great, we've classified that, you're welcome, off you go out into the world to manage that. which
Yes.
which I'm sure again we'll get into, as far as how that can be quite problematic.
Yes, most definitely.
So what about, like, we've talked a bit about signs and symptoms. I'd like to dive into that a little bit more if there's anything we've missed, but I'm curious at this point about yourself, if you're happy to talk about it, like when we talk about these types of signs that start to happen and that diagnostic process. Like, was that something that, did you actually go through that? Like, did you go through being told you have chronic fatigue, or was it more something that, being interested in your health and working with your own health, that you kind of put two and two together? Because as I said at the start, I actually don't know. I'm very
Yeah,
curious.
and I was trying to think back because it's the first, which I'm sure we'll get into a little bit later on, but for the first time that I had it was probably maybe 7 or 8 years ago now. So I'm trying to remember it all from back then. But for me, it was a little bit different, I suppose you might say. So yeah, where do I start? It looks as though mine was actually attributed to a virus that I had beforehand. And so it was basically night and day. So I had this virus for a period of time, and then I did recover from it, but then it was probably maybe couple of months later. I can remember feeling unwell like one day, and you just thinking like it's a cold or flu or something like that. It wasn't sort of those you know respiratory symptoms. It was more just that like achy, headachy sort of flu feeling. And then it just never went away, and it just progressively got worse. But it was honestly like night and day. One day I was completely fine, even though I'd had this virus before. The next, in inverted commas, I'd healed from that. And then woke up this one day and basically couldn't get out of bed. And that went on for, I would say, I think it was close to 6 months, that it was just this, what on earth is going on? And I think for probably a lot of people, because in the initial stages, you're not aware of chronic fatigue syndrome. You're not thinking on that first day, that first week, or even that first month, what's going on. It's just like, oh gosh, this sickness is taking a long time to get over, or so forth. But then as those weeks rolled around, the months rolled around, you'd go to your doctor, and then I don't know, for me at least, I had, several other practitioners that I went and saw, and, whether it was a naturopath, those sorts of things. So it wasn't so much a clear-cut diagnosis in that initial stage. It probably was, I guess, discussed probably maybe 3 or 4 months in. And that's when I started to do a lot of my own research and really, went down a bit of a rabbit hole as to what on earth this could be. And then it was just really focusing, I suppose, on that healing process. But even looking back in that initial stages, I don't know that I ever actually would have said in that first, few months that this is what I have, if that makes sense.
It actually does. It's interesting hearing your experience there, because that's so true. When it occurs, because it has a chronic nature, you haven't experienced that chronic element yet. You're in that, dare we say, acute phase. Yeah, like you said, you're feeling run down and you're feeling fatigued, but the first logical thought is like, oh geez, this flu's really knocking me around. Oh geez, I must be really exhausted, and from all that stress I've been going through with work. Like I would imagine there's a logical thought pattern first that occurs, and it's not until the weeks turn into months, it's just like, hang on a second, something's not right here. So it totally makes sense. And I think that's where there would be an absolute frustration. And I know from seeing that with clients, of having to go through that process first, because it's not like, you just wake up one day and go, oh, I think this might be chronic fatigue. I better take myself up and see someone that knows how to deal with this.
Exactly. Yeah. And I like, when we speak about, IBS, for example, or other syndromes, it can be a similar process, because sometimes, say, for example, with IBS, they might have a bout of gastro, for example, which might be that trigger for their IBS. So, and in those initial stages, they might be thinking, oh, this gastro's just really knocked me around. And then it's, not until months, years later, they start to think, this isn't just the remnants of gastro anymore.
Yeah.
So
so true.
It's I would say that it's very much, as much as it is a physical condition, the mental health effects of it, I would say, are equal to the physical side effects.
That makes sense.
For sure.
Yeah, it makes absolute sense. I actually remember when I first started practicing, having in the first year, I would say my first ever challenging client, which I look back on now. Wow, I was just thinking about her before. It's kind of strange to bring it up now. Maybe it was serendipity that I was thinking about it, because it wasn't to do with this topic. I just remember being like, wow, this is like full on. There's so much going on here with that client. And she was a chronic fatigue client. But what I do remember was the emotional, mental, I would say battle, but also fatigue in its own right. that, yeah, she brought into those consultations. And as a new practitioner, I would say that was what I found the most confronting and probably the most challenging to work with. And she taught me a lot, straight up, about not only what's physically going on with the body, but also like how do we work with this from an emotional and mental capacity. And then also how does the client, how does their emotional, mental capacity and experience of this as a condition, if you will, then have a knock-on effect onto their healing or ability to help themselves heal. And yeah, it's kind of fascinating as far as like how it can become like either a negative feedback loop, or if it's in the right way, a positive feedback loop.
Yeah. Yeah, it's just, I feel like it's one of those things, it's so multi-layered, and it's like I said, the mental health capacity, it's sort of like that's, one side of it. If you look at it from, even just a biochemical level in terms of the effect that it's actually having on the brain and the neurotransmitters and all of that sort of mental functioning. But then it's also compounded, sorry, with the fact that they're dealing with all of these symptoms, sorry. Then there's that, that mental health aspect of this. I'm dealing with this, condition sort of thing. So it's kind of twofold. They're having the physiological effects as well as that emotional, mental load.
For sure. So let's talk a bit about the causes and potential triggers. I know you touched on that a little bit a moment ago, and even again, I'm sure with now hindsight, looking at your own experience there, and as a practitioner, definitely the ability to unpack that and look back and go, okay, now I can see this equaled this and this, and okay, this is how this potentially happened. But of course, that isn't the same story for every person. So, yeah, can you speak a little bit about these potential causes or trigger events, and of course the diversity of that?
Yeah. So again, this is where it gets a little bit tricky, and I think this is why it can be such a bit of an aloof condition and something that's often sort of misdiagnosed, because there's still no clear-cut understanding in the literature or, across the industry as to what actually causes it. So I guess with that aside, the top sort of causes that I see in clinic and that's, documented in the research is there is a genetic component to it. What that is again, still a little bit aloof, but it can basically say that some individuals are more predisposed, genetically to getting something like this. The one that I do see more often is post-infectious chronic fatigue. So looking at sort of that post-viral malaise and fatigue. And one of the biggest ones is glandular fever or Epstein-Barr virus. And that can be a tricky one, because I'm sure people that have experienced that in the past know that that is something that often stays with you, and it's something that can flare up from time to time. So you've got that, obviously, you've got to be mindful that you don't want the virus to flare up again, but then there's that, flow-on effect that you may be at risk of getting a flare up in the chronic fatigue from that as well. And then I did just also want to touch on, so with the Epstein-Barr virus, for those that might not be aware of it, I think that it's also called mono in other countries as well. If that's something you've experienced, or that glandular fever. Then it can be similar sorts of trauma as well. So whether or not it's like a family trauma, or like more like if you're dealing with grief or loss, those sorts of side of things, it can be an effect of that. But it can also be trauma in the sense of physical trauma. So whether or not you've had a brain injury or some sort of concussion, those sorts of side of things as well. And then also looking more sort of at that biochemical level, it's that nutrient deficiencies, which obviously can cause, an array of symptoms. And if they are there for a prolonged period of time, we can look at things like mitochondrial dysfunction, which is, it can be a cause, but it's more so, part of the condition itself. And then this one's a little bit a little bit interesting, and I wasn't sure whether or not to touch on it as well. But there's also, in my opinion, and I guess from my personal experience as well as what I have seen with clients, is more of that metaphysical experience or esoteric experience, if you will. So, whether or not you are experiencing challenges in your life and it's sort of like that burnout, for lack of a better word, and whether or not it's like a redirection, if you will. That's something that I've seen, both personally and also with clients as well. It's sort of that, not so much like a midlife crisis, but it can be that, what am I doing here? I need to reassess. So
yeah, interesting. As in like a knock-on effect of that as a stressor, or more on a deeper level of like the body creating a space that actually stops you in your tracks and forces you to stop and to reassess.
Yeah, I think twofold. I think the stress element is, that would be like the top. If I had to put, if I had to prioritize them, stress and that HPA axis dysfunction would be certainly the leading cause in my experience. But then, like you say, more from that sort of deeper level, and I'm very well aware that this is a nutrition related podcast, so I didn't want to
I love it
go into it too much. But it's just that I guess the body, the universe, whatever you want to call it.
Yeah. I was speaking to Carissa earlier today about something in relation to this, which with time I'm sure she'll share, but she would agree with you, I think 100%. But it's, I think you see that on many levels as a practitioner, where there's sometimes a bigger question as to the why. But I must 100% agree as far as what you physically see in clinic, as far as the impact of chronic stress for like years on end. And that is something that we'll talk about in a little bit as far as potential testing options. And I know over the years I've seen signs of potentially going that way, where there's already so many signs in how someone is feeling, and you can see with testing, it's like, or if you keep pushing and you keep pushing, this is going into a potentially dangerous place. And then, post-viral, which I know sometimes gets thrown around, like as far as post-viral fatigue. I feel like they're so like layered on top of each other when it comes to chronic fatigue and post-viral fatigue, like very much one and the other. Like I do see a lot of that. And then, obviously even I would say the gut to a point as well, as far as what we would see clinically, as far as how someone's fatigue levels can be so profound and so great and experienced. Because like if you're looking at even, the criteria diagnostic, we'll call it diagnostic, but if you're looking at that syndrome classification, you could look at some clients with ongoing chronic gut issues and they'd be like tick, 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 from the joint pain and the aches to obviously the debilitating fatigue itself and the lack of concentration. And it's quite profound how you can see that impact from a gut level, which plays into a lot of what you've said too, even from a nutrient deficiency component. When you were talking about even mitochondrial function, I was thinking of that, as far as like just basic, very, very important nutrition that we need on a day-to-day basis to function effectively, and neurotransmitter function if we've got like so much chronic inflammation in the gut. That's just like clinically something that I know that we see a lot, and often another layer embedded in something like stress or something like post-viral fatigue.
Yeah, well, I think that's where a lot of it comes down to sort of that multi-layered aspect to it as well, because say, for example, somebody will come in and they've got, that chronic stress, or they're on that cusp of burnout. It's not, it's very rare that you'll see somebody that's coming in and they've got that burnout, that chronic, stress picture going on, but their gut health is wonderful. They're eating beautifully, their digestion's perfect. Every other aspect of their life is just wonderful. It's that's never the case. It's obviously that, okay, so they're coming in, they're stressed, they're on that cusp of burnout. So what does that actually mean for them? That probably means that maybe they're skipping breakfast. Okay, so what does that mean? Oh, well, that means that then maybe they've got elevated cortisol first thing in the morning, or they are just generally lacking in energy in terms of the calories that they're eating. And then the flow-on effect of that is we're looking at nutrient deficiencies. And it's just this cascade, because then that leads into poor sleep quality. And it's just, this gradual descent into what we can see as chronic fatigue. So whilst there is, the like those genetic predispositions, and then there's also, those viruses that can trigger, I think that they are, I do see them, but the leading one is that stress that we see, that chronic stress. But then it's really, it's not just the stress that's caused this, it's what stress has then caused, and then that flow-on effect from there.
Yeah, absolutely. Yeah. Very, very multi-layered, which is interesting in regard to then thinking about it from a treatment point of view. I think already that highlights the complexities, particularly of how we would look at treatment. But what about even from a medical or conventional model? What do those treatment options tend to look like? And was that even something yourself that you dabbled in before going into the nutritional options or naturopathic options?
Well, from my experience, when it sort of all happened, there wasn't really, and this was still only 7 or 8 years ago, there really wasn't as much recognition, and there wasn't much that the doctors could really offer me back then. It's only since probably in the last couple of years, since I've really delved into it from more of a clinical space, that I feel like we've come a long way. And I guess maybe I also know the right questions to ask and how to actually communicate with doctors and specialists and those sorts of things to really get more of an understanding around A, the testing options, and then B, also the treatment options. So looking back, there wasn't really a whole lot in terms of testing I had done. Like, I'm sure I probably just had your standard blood tests just to rule out anything sinister. I do recall, like, they can do brain scans, so things like MRIs, and then just, general blood tests and those sorts of things. I know that I guess they're a little bit more across it these days in terms of the triggers of fatigue in itself. So they might send you for testing for your iron studies. They might look at, testing for thyroid conditions and those sorts of things. And if you've got a really comprehensive GP, they'll look a bit deeper, and then they might also send you off to like an endocrinologist, for example, and look at more significant things like potentially Addison's disease and those sorts of things. So I think that side of things has certainly come a long way in terms of how they would start to investigate. From a medical perspective at the moment, and, like I said, I'm having not, needed to go down that path that recently. I'm sure it has changed significantly, but in terms of treatment, I know that at the time, and even to this day, a lot of the ways that they do actually treat is through antidepressants, which is, it's really unfortunate. And I think it's probably, again, multi-layered. On one hand, a lot of the doctors, not to throw anyone under the bus, but a lot of them just don't know how to treat this. They don't really understand it from that sort of biochemical level. A lot of them do just think that maybe there is that mental health, capacity that's involved. And so I think in some cases, sure, it's a lazy treatment, but I think sometimes that's all that they have in their toolkit to use.
Agreed.
And that in itself just, I feel like, sends you on a whole nother cascade in terms of the effects that can have on your mental health, and then also on the gut. And it just, yeah, it's certainly not the road that I would be recommending people go down if they can avoid it.
For sure.
Yeah, so I guess from there, if you're not seeing your general practitioner, they would typically refer you to an endocrinologist, in my experience, and what I've seen in clinic, because they can look at sort of that hormone element when we're thinking about things like cortisol, or how the adrenals might be functioning, and those sorts of areas. I would say that would be sort of their key focus. And then on the flip side of that, from more of a functional, integrated perspective, in terms of testing, I feel like we've got, a huge advantage in this realm. And this is where, since being in practice, and even just during my studies, I was like, wow, if I knew what I know now back then, I think life would have taken a very different path. But yeah, I guess functionally, I'd be looking at things like, most certainly, stool testing for one. So having a look at what's actually going on with the gut, because there's just so much we can see now in terms of what markers are elevated, what inflammation pathways are going on, what detoxification pathways are compromised, those sorts of side of things. The one that I'm more recently getting involved in is the organic acid testing. I think that's can play a huge role in terms of even just looking at energy production, and how like looking at the Krebs cycle and ATP production and those sorts of side of things. And that can also play into that mitochondrial dysfunction, and really getting a handle on what's going on there. And then also looking at Dutch testing, so that dried urine hormone testing. So that can be another, I probably wouldn't be looking at it more from a sex hormone perspective. I'd be looking at it more from that cortisol picture. So I guess they're probably the three standouts, but they would come after I'd be looking at, complete iron studies, complete thyroid panels, and I'm talking, reverse T3, thyroid antibodies, those sorts of that side of things, not just looking at TSH. And then also, obviously, just your key nutrients, so B12, zinc status, iron, just making sure sort of all those foundational levels are covered as well.
No, beautiful. And I do, just to go back to like the testing from a more conventional model, and I think this is what we see a lot of in clinic and clients that do come to us, is that even with someone who has done comprehensive testing as far as they can do, and then potentially referred to an endocrinologist, a lot of these people are coming back with a clear bill of health. Like, there's a very often blood work that has been given, and they're just at their wits' end, because it's like, well, I've been told everything's fine, which is where we would look more closely at those bloods as far as ranges, to see where things actually are sitting. And they may be fine, again, not throwing shade on like that there's something being missed, but sometimes we can look at we'll see patterns of maybe someone's white blood cells and how they were behaving before this event occurred and how they're behaving now and what those levels look like. Or even like the viral side of things, that might be looking at past viral exposure and maybe doing a bit more of an investigation there as well. But the exciting thing is, as you said, Christine, like once it comes to our toolbox, it's like, okay, now we have the tools. Like, it's the medical model gets to a point, and clinically their resolution, or their only sort of tool that they tend to have is something like antidepressants, whereas we have this like array of toolboxes which enables us to dig deeper. And it's somewhere where I wish that, and I'm sure with time, like, we could get more all on the same page, where you could have these clients or these patients with their GP, where the GP gets this point, it's just like, okay, I've done everything. I've exhausted everything my end. It just definitely seems like chronic fatigue. Now it's time to handball you over to a clinical nutritionist or someone of the like that can do this. And I know it's getting better, but yeah, often we have people come to us who are at their wit's end and they're just like, apparently there's nothing wrong with me, but I can't get out of bed every day. And the only other test that I just wanted to mention as well, and I definitely don't want to go on a rabbit hole on it, but with, you mentioned the oat and so forth, is sometimes with these types of fatigue presentations there can be issues with mold, and it's not common, but probably something that is a little bit more on the rise, particularly around Brisbane with a lot of the floodings and so forth. But we mentioned about the organic acid test. There can sometimes be some signs in that, but there are some specific types of tests that can be done too. So even if there's listeners that have gotten to a certain point with what we're saying and they're like, I've done this, I've done that, I've done that, like it's definitely worth just mentioning, as far as how sometimes with chronic fatigue, there can be some other factors that are going on that are a little bit deeper. I always call it, the lower funnel stuff is like the top of the funnel to us are the more everyday things like the gut and the adrenals and stress. And it's like, well, we've got to make sure they're all okay. But definitely as we're moving through, and just for people who are like, yeah, again, I've done this, I've done that, can there be some other elements that are going on? And I guess that's our thing, isn't it? As practitioners too, we're always like, there's got to be a why. Like you're fatigued for a reason. Or if you have IBS, your bowel is irritated for a reason. Like we just need to figure out what that is.
Yes, exactly.
Yeah. So I want to move on a little bit to the concept of like nutritionally what we can do, and different lifestyle factors. But I just wanted to circle back to the challenge factor of living with this as a condition before we get into that. And just, I guess, there's an element of acknowledging that, which you already have, but maybe to paint a little bit of a picture for these clients of what some of those challenges can be. And maybe, I think, again, you've mentioned this in relation to even the process of trying to figure out what the hell is going on. But yourself, I'm interested if there were some challenges that you went through that you now also have been able to bring as a practitioner to the table and have that deeper level of empathy for.
Yeah, definitely. I think, and as we have touched on it earlier today, I think probably the leading challenge, at least in my experience, was really that initial shock, trying to understand what on earth is going on, and to really, I guess, come to terms with that as well. And a lot of that, there's it's a huge load in terms of, that psychological aspect. You're almost going through a bit of a grief in terms of what your life once was. And for many people like myself, it's, one day you're fine, the next day it's like your whole world's changed in terms of your capability to work, to earn an income, to socialize, spend time with friends and family, to basically do anything that you'd once done. A lot of that overnight can change very quickly. And so that mental side of things, I think, is probably one of the biggest challenges. And then I guess hand in hand with that is the effects that can have on your family and your friendships and your work as well. So if we're looking at, your ability to work, so obviously a lot of the time, for myself included, I wasn't able to work, and so there's that added financial strain and having to rely on potentially family members to support you through that time, and then, if you're looking at somebody that's potentially got children, then they've got that added pressure that they're a provider and they're not able to provide for others, is a huge, burden to carry. And then another thing that I found especially tricky was really trying to communicate what I was going through with other people, with family members, with friends. And I think these days there is a lot more recognition, a lot more people are aware of what it is. But it's tricky because, there's so many conditions that we see these days that are, classed as those invisible conditions. And
true.
so from the outside, no one can see that you've got maybe a broken leg, or, there's nothing physical about the condition a lot of the time. And so to try and communicate what you're experiencing with those around you can be really challenging. And especially when it's, a lot of the time it's not necessarily pain related. It is more that fatigue presentation. So a lot of people are just like, oh, we'll just go have a nap, just don't work so hard, or, those sorts of things. And it's just, until you've experienced it yourself, you really can't articulate the difference between fatigue and being tired. And still to this day, it's so, I'm so aware of it. I know when I've got a day where I'm like feeling that fatigue, or I've got a day where I'm just feeling tired. So just being able to really communicate that with, obviously, your healthcare providers, but more so from your support network, can be really challenging as well. And then obviously the stress that sort of goes alongside with all of those elements. It's like, on one hand, you're like, I shouldn't be stressed because that's how I got here. But how do you not feel stressed when you can't, pay your bills, or you can't, see the people that you want to see, or, maybe, like for me, for example, I really enjoyed exercise. Like, I wasn't a gym junkie by any means, but I loved getting up and going for a walk in the mornings. And to not be able to do that was just, it was such a big part of your, I guess, your life and who you consider yourself to be, your character.
Yeah,
a
your
lot
identity.
Of those elements, were really stripped away in so many different aspects of your life, in terms of what you're capable of, what you do day in, day out. All of those things can change so quickly. And and then I think the other side of that is, when you do sort of come out the other side, there is that element of, I've always got to be careful now. I can't push myself too hard because I'm at risk of XYZ. And so it does always sort of play on the back of your mind that you do need to have that sense of, and I mean, of course, it's good to be more mindful of, how you need to look after yourself, but sometimes it's just like, I just want to live my life without having to, worry about pushing myself too hard, or have I had all the nutrients I need to have to make sure my mitochondria are functioning properly.
Like, and now I'm stressing too much about having all the nutrients for my mitochondria.
Exactly.
You explained that so well, like, and thank you for sharing your side of that. Like, that was really, really in depth. And I feel like anyone who suffers with chronic fatigue and is listening will just be feeling so seen right now with how you explain that. So, thank you.
Yeah. Well, I just hope it's also helpful to those potentially that are listening, that maybe they are helping to care for someone that does have it at the moment. Because, obviously there's the burden that you're carrying when you're going through it, but it's equally as hard for those that are around you, and they can see you're struggling, but they can't do anything. Of course, there's things that they can do to support you, but for the larger part of things, there's not much that they can do. And so I suppose, giving some education around how to maybe support those people in your life, or just, more of an understanding as to what these people might be actually going through.
Yeah, 100%. So what about treatment options? So particularly with our toolbox, like nutritionally, what we might be able to look at, and then I'd love to talk a little bit about the lifestyle side of things, which in its own right can be quite big. And obviously we're not going to mention any particular products here, as we never do on the podcast, guys. But is there some standouts that you wanted to discuss, which is really hard because I think, again, we've just laid out that this is such a multifactorial area. So this in its own right would be multifactorial, but I'm sure you've got some strong thoughts about some particulars.
Yeah. So Again, it'll come back to more so that testing side of things. So,
Mm,
say for example, we've started with maybe a stool test, and we can see that there's quite a number of markers that are out of balance. So, if it's more driven by dysbiosis or some sort of inflammation with that GI tract, we'd be looking at going in and treating that microbiome. So, whether or not it's through the use of probiotics or like a dietary approach in terms of establishing more of a healthy microbiome, and addressing sort of those dysbiotic areas as well. That would be sort of one aspect you could take. But then if it's more so the case of looking at maybe nutrient deficiencies, we can be looking at things like your B vitamin groups and your essential minerals and vitamins, and so those sorts of aspects, and making sure that sort of foundational level is really taken care of as well. Um, then in terms of like more dietary focused, heavily focused on anti-inflammatory for one, because a lot of what we can see, especially if it is more driven by like a post-viral sort of situation, we can see a lot of neuroinflammation as well. So that's when, obviously the neurons, especially sort of in that across that blood-brain barrier, we can see some issues there. So really supporting that inflammation that might be present there, but also on a systemic level as well. And then sort of, I guess, hand in hand with that, looking at more of an antioxidant approach as well, and really focusing on those foods that are really high in antioxidants to reduce any oxidative stress that might be contributing to it as well. They're probably the main areas that I would focus, and then from there it'd be more targeted as to
mm.
what I'd be doing each individual. But they are sort of the foundations that I'd be looking at for anyone that was presenting sort of with an array of symptoms and potential causes.
For sure. Yeah. And I think you just, you highlighted even with that, it is quite diverse. It is going to depend on where the actual driver is coming from. And where in a case like this, I would say most circumstances, some type of functional testing is going to be needed. Like it will just be such a necessity to get some clear markers as to which direction to go, and then to be able to tailor around that. And it's definitely cases where I think you could have person A versus person B versus person C with chronic fatigue, and they would all look very different in how they were tackling getting better because of what that driver might be. So it's an interesting one. And I think from our perspective, again, the exciting thing is there is just so much that we can do. Like, okay, yep, this is driven by the gut. We've got all of these things we can do. This is driven by HPA dysfunction. Like, oh, wow, great. We've got all of these tools and this is what we can do. Or there's a massive viral element here. So, or we've got these layered effects. We do have a lot we can bring to the table. And for someone who has only been up to a point given maybe antidepressants as their only option, that is really, really exciting. But then there's the whole lifestyle side as well. And again, I'm sure even yourself and management of this, in both cases, there would have been things that would have been important for yourself. It would be interesting actually just to know with yourself nutritionally, because you had a lot, I think, that you already knew, but I'm sure it helped you maybe hone in a little bit more in certain areas. But what you're even saying about your own experience and that more kind of what did you call it? I want to say esoteric, but was that the word you used? I feel like that's really the wrong word to use. It sounds like it's really woo-woo.
I know. Well, I mean, it's hard to pinpoint. I suppose, esoteric or metaphysical.
Metaphysical.
Whatever.
I like that better. Yeah. Metaphysical layer. Like that component, I feel like really drives lifestyle changes. So I don't know whether that was something that you experienced.
Yeah, massively. And even from a nutritional point of view, like as much as I'm sorry, I'll start again. I had experienced this prior to doing significant study in the nutrition world. So
Mm-hmm.
as much as I had an interest in, health and nutrition, I had no idea the impact that diet and even lifestyle could really have on sort of my recovery, or even, was it playing a role in terms of having the fatigue in the first place. So I think just sort of circling back a little bit is that diet aspect, it actually can be quite a challenging thing, because you can imagine if someone's feeling especially fatigued and they've going through those challenges mentally as well. Often the last thing that they want to do is get up and prepare a healthy meal 3 times a day. So it's a bit of a double-edged sword. It's sort of like that's what they really need to be doing in terms of optimizing their diet, but often that can be one of the first things to fall by the wayside, not only from that fatigue perspective, but then also from the potential impacts in the GI in the GI realm as well. So whether or not it's like a loss of appetite or implications on their stomach acid and those sorts of side of things as well. So so I think nutritionally it's obviously a key component, but I did just want to acknowledge that I can understand if you're listening to this and your diet's not on point at the moment. I empathize with you, and I can understand that, how that can sort of play a role, if you will. But in terms of lifestyle, for me, it was really focusing on a support network. So being able to rely on friends and family, and really getting sort of an understanding from them as to what was going on. And a lot of the time this would vary in terms of, who I was actually communicating with, but not everyone really understood what I was going through, but they did the best that they could, if that made sense. So they were able to, to support me in ways that was manageable for them. And if you can really build up that network in terms of friends and family, and really try and communicate to the best of your ability what you're going through and what your needs are at that time. And then further to that, also looking at your healthcare network. So this can be, things from your GP to maybe a clinical nutritionist, a naturopath, but then it can also be other therapies. So maybe you might get benefit from seeing an acupuncturist, or a kinesiologist, or maybe massage therapy can be helpful if you're getting more of those, muscle aches and joints and joint pains and those sorts of things. So really building a good network around you can be really, really helpful, especially for that mental health picture, and really helping you get a grasp on that side of things as well. And for me personally, I suppose hand in hand with that, I did do a lot of sort of mindfulness activities. So things like meditation, breath work. There's not a lot you can do when you're fatigued. So things like
you can
meditation.
Do breath work.
Exactly. So yes, I there was a lot of guided meditations that I used to do, and breath work and those sorts of things. And actually, there was another thing that at the time my GP was quite open-minded, and so he'd done sort of a bit of work in that area as well. And he'd mentioned it was like a brain training course that they have available. I'm sure that there's
not Gupta.
There's a few. No, it wasn't
Gupta.
Gupta. I think it might be DNRS, something like that. You'll have to have a look at it. It's been a little while since I looked. Yeah, so that was something that I went through as well, and it's I think more so focusing on that neuroinflammation and building different neural pathways and those sort of side of things as well. So that was really, impressive having that come through sort of the medical realm. And then I guess from there, it's more those foundational things. So looking at if you are able to do any form of exercise, even if it is, a 2-minute walk outside in the sunshine, and just obviously that the effects that's going to have on your physical health, but on that mental health. And then you can look at, your vitamin D from your sunlight exposure and those sorts of side of things. So the lifestyle factors will really vary depending on the severity of the fatigue. So some people it's not as severe and they might be able to do a bit of light exercise. And if that is the case, looking at maybe some weight bearing exercise to help, focus on your bone mass and your muscle mass and those sorts of things. But for others, it can be a lot more severe. So looking at things like just that gentle walk around the block, or even just sitting outside and getting some sunlight exposure can be really helpful as well.
I imagine I was thinking also psychology when you're talking about other therapists, like you mentioning how much of a mental emotional challenge this could be, or is, like having someone on your team from that perspective for a lot of people would be really valuable in so many facets.
I did leave that out actually. Yeah.
Did you?
Should have put that one in
Oh,
there. Yeah, definitely. Yeah. Yeah, that was a key factor as well. But it's tricky because sometimes I hesitate to mention all of these different things, because I know that for a lot of people, when they are going through this, there is that, that financial strain on things as well.
Absolutely.
A lot of the time, it's, when you think about, I'd love to go and get acupuncture, I'd love to go and do these sorts of things. It's not always accessible. But just bear in mind that you can speak to your GP and get things like your mental health care plan, which can really help to alleviate some of those costs as well. So
and also, as you said, it's not every one of these things is going to be for everyone, depending on what that driver is, as you're alluding to with exercise. So, even though you're listing a lot of options here, I think that's really valuable for people who are listening, and if they are experiencing chronic fatigue, it might be just that person that hears, well, I've done all those things, but wow, Christine's really kind of connected the dots, how much this has been affecting me emotionally, mentally. I think I do need to go and see a psychologist. So, you never know. So I think it's definitely valuable to point out. And I'm curious, before we sort of finish up, if you don't mind sharing, like, I feel there may not be an easy answer to this, but and I say this because I think people listening will be very curious, whether you feel like there was defining factors for yourself when it came to feeling better. And I know it's not like, oh, I'm healed, like this is potentially something that you manage moving forward. But did you feel like there were some key factors for you that helped you move out of being like chronically fatigued?
Yeah, and this is actually quite recent. So without going too far into it, I've actually had two instances of it. So the first one was, probably 7 or 8 years ago. And then I did have a flare up about 3 years ago, maybe just over 3 years ago now. And the second one for me was far more significant than the first. And so with that second one, I was much more into, the nutrition world. So I had a lot more of an understanding around what could be going on, which was probably more a curse than a blessing in some ways. It's like, have these mind maps everywhere, and this is connected to this, and this is, oh gosh, went on and on. But for me, most recently, I would say that doing functional stool testing was probably one of the key factors that made the most significant difference. And it's hard without mentioning numbers and names and things, but there were some markers there that when I saw them on the paper and when I really looked into what actually was going on in terms of their role in the gut and systemically, it was very insightful. But then when I actually did the treatment that went along with that, it was, it basically took me from probably 60 to 80%, which for some people might not sound like a lot, but when you're in the throes of chronic fatigue, that's a significant improvement. So
absolutely.
I mean, obviously to that, I'd also been doing a lot of that foundational work that we mentioned in terms of diet and so forth, and a lot of that mental work. But that stool testing was very pivotal in terms of
No, thanks for sharing, because I just know
better.
people listening would be curious. So just be like, what did she do? She sounds great. What did she do? And again, everyone is different. Everyone's circumstances will
Yes.
be different, which we've, I hope, gotten across. But yeah, just for curiosity's sake, that's for sure. And
Yes, most.
is there any like final tips or like kind of pearls or advice that you would give to anyone who's experiencing chronic fatigue?
I'm not sure about pearls, but I did just really want to drive home that, well, a couple of things. The first thing is you're not crazy. You know,
Mm,
it's not all in your head. It is, you know, it's a real thing. And even though we don't really have, you know, a definitive cause or a real pathological understanding behind what's going on, and I really do think that we are going to have that, you know, in years to come. There's a lot of research going on into that at the moment. So yeah, there's that, you know, just honor yourself, and that, and really understand that this is real for you. And and as much as it can be challenging when you are in the throes of it, I just really want you to stay hopeful and to trust that you will get through it. And if you can, yeah, really seek out the right healthcare providers for you. I know it can take time
mm.
in finding the right one for you, and it might be several people that can help put the puzzle together for you. But yeah, just really try and stay hopeful, and know that there are options out there for you.
Yeah, no, perfectly said. Love it. Thank you so much. This has been real. This hour has flown, by the way. I've just been like, just soaking this all up. um, if people want to know more about you, find you on socials, get in contact with you, want to come and see you at the clinic, how do they do so?
Yeah, so you can find me. I'm most active over on Instagram. So that is just christine.nutritionist. And then from there, you can find me through the JCN clinic, or you can just go direct to the JCN website and book in. So I am in clinic, in the Brisbane clinic on Wednesdays at the moment. And then I'm also doing telehealth as well. So lots of availability in the new year as well. So yeah, I'd love to work with you if this is something that's been going on. But come over and say hello.
Wonderful. Yeah, no, thank you so much again. I know listeners are going to get so much from this. We've actually had quite a few listeners hit us up over the past year about this topic, and I don't think that we've spent a significant amount of time giving it the attention that it is needed. So this has just been perfect. So yeah, I really appreciate you giving this some time, and I know we'll have further discussions on the podcast, that's for sure. But thank you.
Oh, thank you for having me. Yes, I look forward to coming back.
And thank you everyone for listening. We appreciate it so much. And like always, would love if you would share this episode, particularly as always, if this has resonated with you, or if you know someone who needs to listen. As Christine highlighted, it's not always just about the person that's experiencing chronic fatigue. It's also about the community around them. So it's a really great one to share. But thank you for joining us, and we'll catch you next time. Bye.
Thank you. Bye.